Welcome to Respiratory Disorders and a Variety of Therapies. Although there are a lot of slides, the majority of them are pictures for you to see what we use in pediatrics. So we begin with oxygen therapy, which you should be very familiar with. As an adults, we can deliver oxygen via nasal cannula as well as masks. We have the simple mask and we have the non-rebreather mask. I have listed on the right-hand side the percentage of oxygen based on the number of liters per minute you're delivering via a nasal cannula. For many of you, this is going to be good information to know. We have something that's being used more and more frequently for our children who are admitted for severe bronchiolitis, and you will see it used in the NICU, and this is a high-flow nasal cannula. The benefit of this is we can adapt the device to the nares of the infant or child, but it delivers a heated and humidified gas at a higher rate of flow. In doing so, it decreases the work of breathing, and it does this by decreasing the amount of air that's lost through the dead space in the nasopharyngeal area. It also increases the mucociliary clearance that's in the lungs and ultimately delivers more oxygen. This device is midway between the classical delivery systems for oxygen, like the high concentration face mask, and use of a CPAP. On this slide, you can see that, based on the size, the maximum flow in liters per minute that the high-flow nasal cannula can deliver. On this slide, you can see, when we switch over to a non-rebreather mask, what the percentage of oxygen delivery is. You may want to clip this slide and the other slide regarding nasal cannula flow, cut it out, put it in that peripheral brain. This is a baby that's underneath an oxygen hood. We're not using that very frequently, but I do see it every once in a while in the NICU. And here's a baby with the nasal cannula. We discussed this in Skills Lab. And here's a little one that's using an oxygen mask. Oxygen cannula and mask. And this is a very complicated looking child who's using a nasal CPAP. You can see how it consumes the whole head. And so we're switching over to that high flow nasal cannula. It doesn't mean that all kids will be on that, but if they can go without the CPAP, they'll be using the high-flow cannula. Here's another one with nasal CPAP. And look at this little one. This baby is probably about a 23 or 24 weeker and requires CPAP. Here's a photo of an infant who is intubated, and you can see where the tip of the tube ends and is able to deliver oxygen to both lungs. Here's another infant that has a nasal intubation instead of oral intubation. And here's a baby that is intubated and has inline suction available. This photo demonstrates a tracheostomy tube inserted. And here's a little guy who has a trach tube, and he's very used to it. This child recently had the tracheostomy placed, and you can see the sutures. So until this heals enough, we're going to keep those sutures in place. And look at this little guy. Is he cute or what? He has padded ties, and these are the old cloth ties. They can cut into the skin. Anytime you have a patient with a tracheostomy, you have to make sure that you do a full skin inspection, because they can have skin breakdown behind the neck. And then this is the picture of correct placement of an oral airway. This ends part 2 of respiratory disorders.